our health slot this evening, we're joined by Dr. Nelson Makemba to speak to us about urinary tract infections that are common infections that happens when bacteria, often from the skin or rectum, enters the urethra and infects the urinary tract. Doctor, good evening and welcome. Thank you so much for joining us.
Thank you for having me on the program.
Doctor, how does bacteria from the skin or rectum, as I alluded to in my intro, enter the urethra?
Especially when you look at urinary tract infection, quite commonly so it happens in our female counterpart, the reason being because of their anatomy. The urethra, which is basically the duct that sort of conveys the urine from the bladder out of your body, especially with our female, it's a bit shorter and it's closer one to the surrounding, meaning that, you know, the surrounding area, especially if a lady, for instance, uses the bathroom and when she wipes, she goes from the back to the front. She can easily bring all that bacteria from the rectum up front, then it migrates sort of easily to the urethra, colonizing it, going all the way up into the bladder, causing an infection. In our male counterpart, you know, we do see UTI happening as well, but the occurrence is not as common as in our female counterpart. Probably globally, on an annual basis, only 3% of male get infected, but ladies would, you know, from time to time go to their doctors with a urinary tract infection simply because of the anatomy.
It's quite common, isn't it?
Yeah, it's quite common.
In layman's terms, what is the urethra, or maybe where is the urethra?
Yes, like if you look at the urinary tract system, you're looking at the kidneys, and then you have tubes that goes from the kidneys to the bladder called the urethra, and then you have that pee pipe now that leaves the bladder to the outside. That's the urethra. So when we pee, when we go in the bathroom, our urine sort of run down that pipe, that is the urethra. It's basically a duct that sort of conveys urine out of the bladder to the outside. So you can now imagine with our female population, it's so easy because you can even just sit on a toilet pot that is not so clean, and then, you know, if there's a bag there, it can easily find its way to a urethra. And because it's so short compared to male, from the outside to the bladder, the bacteria can travel all the way up to the bladder very fast in a female rather than the male. But obviously male can also get infected with you know, these bugs.
What's the symptoms of this condition, doctor?
Oftentimes, individuals that got urinary tract infection, they have what we call burning on micturition, meaning that when they urinate, they got this burning feeling. They might also have an urge that doesn't really go away when the infection is there, so they are constantly feeling like they want to urinate. They might also urinate as often, passing small amount, you know, multiple times. The urine might have a strong smell. It might appear cloudy. It might also be red or bright pink, or what they often refer to as a color, especially if there's a little bit of blood in it. Female might also experience, particularly around the lower abdomen, what we often refer to as a pelvic pain. These are by far the commonest type of presentation that you tend to see with an individual that have a urinary tract infection.
You mentioned, of course, that male counterparts also are able to contract a UTI, and then you explained how a female would contract a UTI. So how would a male then contract a UTI?
They can contract it through a sexual encounter. For instance, if the female counterpart they are involved with and they are being intimate with has a UTI, it's very easy for them to get it that way. And obviously, apart from the bugs that you get on the skin and then from the rectum, the E. coli, the other bacteria and other, you know, bugs also that often in the background causes other infections such as gonorrhea. Particularly that is commonly seen in the male counterpart. If they pick up a gonorrhea, they might have a UTI secondary to having a gonorrhea. So sexual encounter, especially if one has multiple sexual partners and maybe they are not using protection, that can also somehow, you know, then, you know, contribute to a male counterpart getting infected.
Is this why, you know, it's so common that people would mistake a UTI as an STD, or is it an STD if it's sexually transmitted as well?
STD are probably a category on their own. Yes, indeed, there's always that, you know, overlap in terms of presentation. An individual with a STD can also have, you know, the same symptoms or similar symptoms to those that are having a UTI. But particularly when you're looking at the UTI, the commonest cause of UTI is probably the E. coli, which is the gut bug. But then obviously things like herpes, gonorrhea, chlamydia, mycoplasma that causes STD can also in a nutshell causes a urinary tract infection. Yeah. So there is that overlap. Yeah.
Treatment, doctor, just lastly?
Yeah, treatment basically what tends to happen, and obviously in the background of this presentation we often do a dipstick first and foremost to sort of look for changes on that dipstick. We might send off some urine to do a culture and sensitivity where you culture the bacteria and they're able to also see what antibacteria or what antibiotic is it sensitive to. So the mainstay treatment basically is antibiotic, the so-called alkalinizing agents to sort of just help dilute and flush out the bladder. And you now want to give them something for pain because it can be very painful at times. And the probiotics also, they help restore the flora, and obviously we tend to also just sit down with our patients and give them a health education, particularly surrounding their sexual behavior, just to make sure that they are always cautious. And obviously, hopefully, they stay faithful to one individual.
Yeah. Dr. Makemba, always a pleasure having you here. Thank you so much.
It's a pleasure being here. Thank you for having me.
We'll be right back with quite a treat for our viewers this evening in entertainment. Stay with us.